Have you ever looked in the mirror and noticed your eyebrows are not as full as they used to be? Maybe the outer edges seem to be fading. Maybe one brow looks thinner than the other. Or maybe your eyebrows have slowly become lighter, weaker, and harder to see. For many people over 60, the first reaction is simple. Well, I'm getting older, and sometimes that is true, but not always. Eyebrow thinning after 60 can be a normal part of aging, but it can also be one of those quiet body signals that deserves a closer look. Not because it means something is definitely wrong, not because it should frighten you, but because eyebrows are connected to the same systems that affect your skin, hormones, immune health, nutrition, medications, and overall hair growth. In other words, your eyebrows may be telling a small part of a bigger story. The mistake many people make is treating eyebrow loss as only a cosmetic problem. They immediately think about pencils, serums, or supplements. But before asking, how do I cover this up? It may be more useful to ask, why did this change happen now? That question matters more after 60, because the body often changes gradually. Energy drops a little, skin becomes drier, hair grows more slowly, sleep changes, appetite changes, medications change. And because these changes happen one by one, many people dismiss them as normal aging without noticing the pattern. Eyebrows are easy to overlook. They do not cause pain. They do not stop you from walking, eating, or sleeping. But they are still part of your body's hair cycle. Hair does not grow continuously. It grows, rests, sheds, and grows again. With age, that cycle can slow down. Hair may become finer, the growth phase may become shorter, pigment may fade, and over time, eyebrows can look thinner, lighter, or less defined. That kind of slow, gradual thinning can be very common. But a slow change over 10 years is different from a noticeable change over a few months. Even thinning is different from patchy loss. A little fading is different from eyebrow loss that comes with fatigue, dry skin, itching, rashes, cold intolerance, scalp hair loss, or unexplained weight changes. This is why the pattern matters. One eyebrow hair falling out does not tell you much, but eyebrow thinning combined with other changes may be worth paying attention to. One possible reason is thyroid function. The thyroid is a small gland in the neck, but it influences many parts of the body, including energy level, body temperature, skin, digestion, metabolism, and hair growth. When thyroid activity is too low, the body can slow down in subtle ways. A person may feel more tired than usual. They may feel colder than other people in the same room. Their skin may become dry. Constipation may become more common. Weight may change. Thinking may feel slower. Hair may become dry, coarse, brittle, or thinner. For some people, eyebrow thinning can be part of that picture, especially when the outer portion of the brows becomes thinner. But this point has to be said carefully. Eyebrow loss does not mean you have a thyroid condition. It is only one possible clue, especially when it appears alongside other symptoms. The responsible step is not to diagnose yourself in the mirror. The responsible step is to notice the pattern and ask your doctor whether thyroid testing makes sense for you. Another possible cause is not inside the hair at all. It may be in the skin underneath. Eyebrow hair grows from follicles in the skin. If that skin becomes inflamed, irritated, scaly, itchy, or infected, the hair can be affected too. Some people develop skin conditions around the eyebrows, such as dermatitis, psoriasis, rosacea, or other inflammatory problems. Others may react to skincare products, eyebrow makeup, dyes, or facial treatments. Some people rub or scratch the area without realizing it, especially if the skin is itchy. Over time, irritation can make the brow area look thinner. That is why it helps to look closely at the skin. Is it calm and normal? Or is it red, flaky, crusted, sore, swollen, or itchy? Those details matter. They can help a healthcare provider decide whether this is mainly a hair issue, a skin issue, or something else. Another possible explanation is autoimmune hair loss. One condition called alopecia areata can cause the immune system to mistakenly attack hair follicles. This can lead to patchy hair loss on the scalp, eyebrows, eyelashes, or other areas. This kind of loss may appear suddenly. It may look like smooth patches where hair used to be. And because eyebrows are so visible, even a small patch can feel upsetting. Still, patchy eyebrow loss does not automatically mean alopecia areata. There are other possible explanations. But if the loss is sudden, uneven, or affecting more than one area, it is worth having it evaluated instead of guessing. Stress on the body can also disturb hair growth. Many people think of stress as worry or grief, and those can matter. But the body can also experience stress from illness, surgery, fever, poor sleep, rapid weight loss, or a difficult recovery period. Hair often responds late. A person may go through an illness or major stress, feel better, and then weeks or months later notice shedding or thinning. That delay can make the connection hard to recognize. For older adults, this is especially important. A hospital stay, infection, operation, medication change, or sudden change in eating habits can affect the body long after the event itself has passed. Eyebrow thinning is not the most common way this shows up, but it can be part of a broader pattern of hair cycle disruption. Nutrition is another piece of the puzzle. Hair is not the body's top priority. The body will protect the brain, heart, immune system, muscles, and major organs first. If nutrition is poor, if protein intake is too low, or if someone has certain deficiencies, hair growth may suffer. This does not mean a single food will bring eyebrows back. And it does not mean every person with eyebrow thinning is malnourished. But after 60, nutrition can become more complicated. Appetite may decrease. Dental problems may make chewing harder. Some people eat less protein without noticing. Others follow restrictive diets. Some have digestive issues. And some medical conditions or medications can affect what the body needs or absorbs. So if eyebrow thinning appears together with weakness, fatigue, poor appetite, unintended weight loss, brittle nails, or general hair thinning, nutrition is worth discussing with a healthcare professional. Medications and medical treatments can also play a role. Some medications are associated with hair changes. Cancer treatments, including chemotherapy or radiation, can also affect eyebrows and eyelashes. But this is where caution is very important. Do not stop a medication because you notice eyebrow thinning. Do not change the dose on your own. And do not assume a medication is the cause without medical guidance. Many older adults take medications that protect the heart, blood pressure, blood sugar, bones, mood, or other important conditions. If you suspect a medicine may be related to hair loss, the safest step is to review it with your doctor or pharmacist. Supplements deserve the same caution. A lot of people see thinning eyebrows and immediately reach for biotin or hair, skin, and nails supplements. But biotin is not a guaranteed fix. It may matter if someone truly has a deficiency, but taking extra biotin does not automatically improve hair growth. High-dose biotin can also interfere with certain lab tests, including some tests used in heart evaluation. For older adults who get regular blood work, that is not a small detail. So before taking high-dose supplements for hair growth, it is worth asking a healthcare professional whether they are appropriate for you. Now, what should you actually watch for? Start with the speed of the change. If your eyebrows have slowly become thinner over many years, that may fit with normal aging. But if the change is sudden, patchy, or clearly worsening, pay closer attention. Then look at the pattern. Are both brows thinning evenly? Is the outer edge fading? Are there round or smooth patches? Are the eyelashes thinning too? Is scalp hair changing at the same time? Next, look at the skin. Redness, scaling, itching, pain, crusting, sores, or swelling around the eyebrows should not be ignored. That may point toward irritation, inflammation, allergy, infection, or a skin condition that needs care. Also pay attention to the rest of your body. Eyebrow thinning becomes more meaningful when it appears with fatigue, feeling unusually cold, dry skin, constipation, unexplained weight change, joint pain, unusual rashes, or persistent inflammation. None of these signs prove a diagnosis, but together, they give your doctor a better picture. And finally, think about timing. Did the eyebrow loss begin after an illness, surgery, major emotional stress, rapid weight loss, a new medication, cancer treatment, or a new skincare product? Sometimes the timeline is the clue. A practical first step is simply to observe carefully. Take a clear photo in good lighting, then compare it after several weeks. This can help you see whether the change is stable, improving, or getting worse. Be gentle with the brow area. Avoid harsh rubbing, aggressive plucking, strong chemicals, or irritating products, especially if the skin already feels sensitive. Support your body with steady habits, balanced meals, enough protein unless your doctor has told you otherwise, good sleep routines, and attention to stress. These habits are not cures for eyebrow loss, but they support the systems that hair growth depends on. And when you talk with a healthcare provider, keep it simple. You might say, I've noticed new eyebrow thinning. Could this be related to thyroid function, skin inflammation, nutrition, medication, or another health issue? That is a clear, reasonable question. You should especially consider medical advice if the eyebrow loss is sudden, patchy, worsening, or happening along with other symptoms. It is also worth checking if the skin is painful, red, scaly, infected looking, or irritated, or if you are losing hair from the scalp, lashes, or other parts of the body at the same time. The main message is this: after 60, thinning eyebrows may be harmless and gradual, but they should not always be dismissed. They are not a diagnosis. They are not a reason to panic, but they can be a quiet signal from the body, especially when they appear with other changes. Your eyebrows are connected to your skin, your hair cycle, your hormones, your immune system, your nutrition, and even your medications. So when you notice them changing, do not jump to the worst conclusion, but do not ignore the pattern either. Look at what changed. Look at when it started. Look at whether anything else in your body changed at the same time. Sometimes, the smallest signs are not there to scare us. They are there to get our attention. And paying attention early is one of the most practical things we can do for our health after 60.